Hello, everybody. Welcome to our session on business intelligence and data. And I will introduce Krista and Nicolette, or really let them introduce themselves. And so we're going to kind of do a bunch of things during our 45 minutes together. So we want to talk about kind of background and how you got to be where you are. We want to talk about how you're using business intelligence and data to make better decisions, both for health, which Krista will talk about the Health Collaborative, and Nicolette will talk about how the city of Cincinnati is using data, and then I can talk about how we're using it at Circle in an AI capacity. And then really we want to kind of dive deep into that topic and then answer any questions that people have. And then I know we have a wide array of people in our audience, so we'll also hopefully tap into some content around things that you needed to know to kind of get into your position, or maybe things you would have wanted to know when you were in college, since we have some college students potentially in the audience. So with that, welcome. And I will start with Krista. So if you want to just introduce yourself and maybe explain a little bit of what you do with the Health Collaborative.
Yeah, so my name is Krista Hyson. I am the Senior Manager of External Relations and the Public Information Officer for the Health Collaborative, but I actually changed jobs a week and a half, and I am going to be the Assistant Director for Emergency Response, and then keeping the Public Information Officer role. So my background is in communications and public health, and epidemiology is the backbone of everything we do and why we do things the way we do things, because without crucial health data, we're kind of lost in this field. So yeah, just that's what I'm doing right now, and I will kick it over to Nicolette.
Hey everybody, it's a little weird transition where all I see is my two co-presenters here, but I see we have 13 of you out here. My name is Nicolette Staten. I am the Director of Performance and Data Analytics for the City of Cincinnati. And in that role, I also serve as the Chief Performance Officer. And I have an office of going to be 10 of us that sit at the enterprise level for the City of Cincinnati and are responsible for basically everything: performance management, data cleaning, data analysis, and then what we're really excited that pulls all of that together is that we also have innovation under our umbrella. So we get to work with the departments in leveraging that data, working towards their performance metrics, but also being able to provide kind of a wraparound service of how can they be applying innovative and future-looking techniques to reach the outcomes that they're striving for. Prior to my current role, I worked for the City of Hamilton in a similar but more analyst level capacity, and I have experience teaching for a couple of local universities. My background is not concretely in data, so my classical education is actually in international studies and geography. So if we happen to have anyone in that background with us today, I think that it has been an extremely invaluable tool to be able to contextualize data through the learning concepts about how our world works and being able to apply that seamlessly onto the data that you're seeing.
All right, now catch your breath. That was a lot. I love it. I'll go last. So Tarek Kamel, I'm the CEO of a company called Circle. Sounds like the word circle, but it's spelled weird. So don't judge me because I'm not a marketer. I'm a data person. So we use data to really bring a consumer grade experience inside of organizations. So if you think about the data Netflix has on you, or Amazon or Spotify, where it's all behavioral. How are you engaging with certain things? And then they use that machine learning to drive personalized experiences across channels. And so we basically do the same thing internally for large organizations around content. So that's kind of what I do as my day job. My background is very technical. So I'm an engineer by trade. I've had a number of startups here in Cincinnati. all really focused around data. The second business I ever started was a sports analytics company. So it's looking at massive amounts of sports data and then using that to predict sports outcomes. So that was a lot of fun. And then there was an IoT business that we built the world's first smart basketball that is taking 6,000 measurements per second and then helping you in real time improve your skills. So that's even a crazier amount of data analysis because it's all done in real time. So I love data. I am really excited to kind of jump into this conversation and share how different organizations are using data to make better decisions. So Krista, I'll kind of throw it back to you. So maybe can you give us some background as to how you got to your current role and what does data mean for you in that role?
Yeah, so I started out actually working for the Army, and I was stationed to ACES, which is the Army Continuing Education System. So I worked with soldiers on a multitude of things when they were about to get out of the Army. So what that meant was kind of looking at their career trajectory and seeing how and where they would fit in a civilian role. So I would help them be like, all right, so you did this, you can kind of do this in the civilian sector. But what I noticed was I kind of saw a lot of patterns and trends on all these things, so such as educational status, access to healthcare, transportation, any of those pieces, and how much it impacted your health. So I decided to go back to school, and I got my master's in public health. And my primary focus was epidemiology, and that is the study of the etiology of diseases. So I know a lot of epi terms are in the news right now, and a lot of people don't know what they mean. And I encourage everybody to Google those if you don't know what it means, because I think one of the most dangerous things occurring right now, especially with COVID, is the amount of misinterpretation of the data, which has caused my current role a lot of difficulty. Because working as a public information officer, I am constantly doing interviews or writing or releasing information, but I need to make it in a way that it's easily understandable to the public. And we are taking so much data. So the Health Collaborative, in a nutshell, it's kind of the Chamber of Commerce of Health is the easiest way I can explain it. However, we're the only organization that I actually know of that has the disaster preparedness BEP grants and ASPR grants. So that is kind of like your public health emergency preparedness grants. But then also we run the region's HIE, or Health Information Exchange. So we're able to take data from master patient indexes and match people. Hey, I've got a patient over here that took a pop-up COVID test, but now I'm going to match it to their file to make sure their primary care is notified and what that means for their place of employment and things like that. So I know I threw a lot at you, but yeah, so my background is mainly in public health and communication, but the way we use data in my current role is for everything, absolutely everything. So like right now, I'd say the biggest data point, well, two, and if anybody is out there that is interested in AI or development of tech, I would say if you have a solution for easily tracking PPE or personal protective equipment, I would love you forever right now. That tracking PPE places a huge burden on our current health system, but we need to know how much is there. So the initial shutdown from COVID impacted us all greatly, but it allowed us to stockpile as a region different materials like gloves, gowns, masks, etc., and to make sure we can take care of our community. But that is still manually tracked, and that is very time consuming. So that's one piece. And then the other piece that is actually a good indicator of how aggressive COVID is in a community is hospitalization rates. So we track daily the occupancy of our overall hospitals. That just doesn't mean how many beds are filled. it means ICU rooms, ventilators, different types of staffing levels, because the more difficult your medical situation, the more specialty care you're going to need. So all those parts and pieces, that is a great way that we've been able to put resources where they need to be, work with federal, state, and local emergency management to make sure that we get the tools in the people's hands to the front lines as fast as possible.
Awesome. Can you give me and everyone else a sense of how many different organizations are providing data into the Health Collaborative?
So we have 273 member hospitals, and that's thousands of people. So that's just the hospital portion and the medical portion. But we also have a lot of FQHC partners or federally qualified health centers like the City of Cincinnati. And then we also have other nonprofits like the United Way that help us with more social determinants of health pieces. So the data points and the amount of data we have access to is massive. And that's what makes our job great. And that's what makes our job really hard. And especially mine, because there's a lot of data agreements, and especially with health information, a lot of HIPAA compliance. So I wish I could have amazing dashboards with different outcomes, but due to data agreements, if there's any lawyers in the group, let's work on that, on how I can share if it's not my data. We just analyze it. So that's what makes it really hard. So, I mean, the amount of, we've got a master patient index with over 9 million people in it. And there's amazing things, like you said before, like, well, if I could dig into how those people live, what their activities are, what their health behaviors are, to then project this is your potential health outcome, just like Netflix is like, well, you watch this, so you might like this. That could be a really, really powerful tool to predict the health of the community.
Yeah, that's great. So let me turn it over to Nicolette. Can you give us some examples of, and it's, I think it's funny that we've got health care and we've got government. And I think most people traditionally think of both of those areas as very late adopters to technology. So Nicolette, I think you're going to surprise some people with how the City of Cincinnati is using data. Can you share some examples?
Yeah, so I think I'll first build off of what Krista was saying around how COVID has really brought to light basically constant data sharing, but we didn't necessarily do due diligence to make sure that the population was ready to consume that data constantly. So that's been a big strategy at the City of Cincinnati. Our office is 5 years old as of this past May. So that's required a lot of growth to get to the point of a lot of the cool things that we're doing now. So I think one of the most important things of moving towards better decisions and how we're leveraging data was first developing a shared understanding of data, not coming in assuming because someone is a director or even because someone has the name data analyst that they actually understand data and that they actually understand how to read that. So before trying to start making decisions off of data was building relationships with departments to gain that trust around their own data, because many of them are collecting tons and tons of data points. The city has approaching countless data sets. My office specifically has an enterprise data warehouse that's connected to over 200 different data systems throughout the city. And from that countless more data sets that we're able to tap into, most of them daily, some of them as frequently as every 15 minutes. So it would have been really easy for us to just churn out a bunch of dashboards. I know I saw some questions over here, like what are our dashboards look like and how do we prioritize? But first was just getting departments to count the same thing the same way. I know it sounds like really simple and really boring, but just like, do Krista and I agree that there are 6 COVID patients right now? Did we both take the same data set out of whatever data system, look at it, and we both say like, yes, there were 6 people right now? So that was a shocking amount of time of building that capacity with departments in which we agreed that the data coming out of their system, how me or our staff is interpreting it, is on the same level, and started with very, very basic types of analysis of counts by week, counts by day. For some departments, it was revolutionary just to see their work geocoded and then mapped. That they kind of have in their brains this idea of like, yeah, I went to Hyde Park 3 times and Westwood twice and Roselawn once, but to really see the whole picture of it. So from those relationships and being able to show what data could do for them, building trust into departments making better decisions, and at that point really being able to leverage the tools. So our big belief in our office is that you always need to be designing for your audience. Like the city specifically leverages Tableau for the vast majority of our visualizations, and anyone can go on Tableau Public and see these masterful, beautiful things that people can make that do crazy things that I have no idea how to even do. But if your customer can't consume that, then it doesn't matter that you've built something cool or pretty or flashy. And we have both the privilege and the challenge of answering to many, many audiences. So the data that we use goes both to operational leadership, out to the public. In addition to everything that I've shared thus far, we're responsible for the city's transparency efforts. So we maintain the city's open data portal, which has over 140 data sets on it. And again, most of those update daily or more frequently. And we also, in a belief that raw data isn't true transparency of a government, because the average person may not have access to Excel or competency in Excel or other visualization tools built Cincy Insights, which is a visualization platform aimed at making some of the premier 60 or so topics of the city accessible for anyone. We like to talk internally about like, can your grandma get on and figure out what happened in her neighborhood? And if no, then I'm not doing my job correctly. That anyone should be able to know information that's happening in their community. So that's kind of a wide overview of internal to external what we're doing. For people on here who are interested in diving into the data, and I'll do like Krista did and send you guys some links when I'm done talking and give it back over, there's tons of open data sets for you guys to dig into about basically every main function in the city. Anytime that you interact with the city or you think of interactions with the city, we're probably getting a data point about it. So if you pick up the phone and call 911, that generates like 3 to 10 data points in 2 different systems. If you submit a customer service request, we get data on that. Every time if you live in the city of Cincinnati that your trash can gets tipped, I get a ping on that. So if you're engaging with the city, you are passively or intentionally contributing to us collecting a lot of information about what's going on in our community.
So let me ask, okay, so you've got all this data, and I think this is where, when you get to be my age, which is old, you see kind of what happened and how we got to where we were. So if I think back 20 years ago, which is crazy, it's really not that long ago, but 20 years ago, it was really difficult to capture lots of data because processing was so expensive, right? The cloud did not exist, storage was expensive, bandwidth is expensive, all of it was expensive. And so then what happened, you know, late, I don't know, 2008, 2009, kind of in that neighborhood, we started to see the emergence of cloud computing and prices plummeted. And really Amazon initiated all of this. And so now we've got the situation, and this ties into a question that Eric Weissman asked. And so I'll turn it over to you guys in a second. So now you've got all this data. How do you find meaning in the data, right? So what is the next step? It's not just enough to have the data because grandma can't figure out what's going on. That's not good enough. How do you take data sets and provide things that are actionable to either become more efficient, save time, see things that people need to know that they can't see otherwise? So can you Nicolette, I'll just stay with you, and then Krista, I'll turn it back over to you. Can you give some examples of, all right, big data, that's great, but give me things that are specific that you're learning from the data through data science or Tableau or other mechanisms.
Yeah, sure. So I think one of the key foundations to what you were sharing was that we've built out a very robust automation platform and are trying to start to work through data-driven notifications because we have copious amounts of data about functions in over 26 departments in the city. And all of us, whether that's the 10 people in my office or the 6,000 city employees, we can't all be doing everything. So we obviously have to pick on prioritization of what we're going to do. So want to move to more data-driven monitoring in which we are only getting notifications similar to what you shared about Circle with Krista and I yesterday. So essentially taking the concept of Circle that everyone should only be getting the data that they need to know about. How can we apply that to a lot of the analysis we're seeing and automate it? So if our building inspections permitting time is perfect, then I don't hear anything about it. I don't need to know because everything's going well right now. But if our 911 call answer time rate is starting to go down, that I do get an email that says like, hey, you really need to check in with the emergency call center this week, something's up. Because we still have a lot of room to grow in data while we do have tons and tons of quantitative data floating around us constantly without really robust machine learning or artificial intelligence. We still have to rely on humans to tell us what really happened. So I might be able to say, we didn't answer the phone as quickly yesterday, but I wasn't up there and I don't know what was going on. So I think what we're trying to drive to is being able to prioritize what we focus on. Unfortunately, in that growth, that's predominantly been around using data to help address whatever emergent situation is happening. I think one of the places where the city was able to use data well, even though it was a very unfortunate circumstance, was for anyone that's familiar with the ineffective 911 call response that unfortunately resulted in the death of a local 16-year-old, that was kind of a wake-up moment for the city. We had been holding routine meetings looking at 911 call data for 3 years at that point. And we knew that there were issues with our system, but we couldn't spur the action that needed to happen. Budgets are tight. A lot of what we were waiting for was that we needed improved technology at that point. So much of a call center is moving towards artificial intelligence or being able to route things quickly, and we didn't have very modern recent technology. Our office had been saying that along with many other people in the city, but budgets kept getting accounted for a certain way. But as we started to respond to that very real situation, that we were able to leverage the data that we had collected before to show where we were and then track our very clear improvements after that. So from the issues, distilling down all of the data and all of the reporting that had been happening for several years helped lead to an action plan that we were able to track and show the implementation and the actual improved call response time. And now the city of Cincinnati, for coming up on the past 2 years, has held an average above national standards on how quickly we answer 911 calls. And now that we've all settled on that being something that we've accomplished, we're now moving towards how can we increase the quality of our 911 response and tracking data around the quality of the calls and feedback from customers of our call center.
Awesome.
And how can we build upon that?
That's great. Krista, can you kind of give some examples from the Health Collaborative in terms of, hey, we've got massive amounts of data. Here's a really concrete example of where we've been able to take action because of what we're seeing?
Yeah, I'll give a small scale one and a large scale one. So take, for example, we have one grant through the Centers for Medicare and Medicaid Innovation. So it's a program called GenH. And GenH stands for Generation Health. And what we do is really try to address those healthcare inequities, especially through the social determinants of health. And what's really cool about one branch of this program is that, take for example, we see John in the ER, and John's in the ER, and we get notified via our master patient index, hey, John's kind of being a frequent flyer in the ER. Let's say it's multiple visits over the course of 3 months. You probably shouldn't be going to the ER multiple times. So we kind of figure out who John has seen and get him signed up for either an FQHC, or maybe he already has a primary care provider and he's just not using them, or whatever the situation may be. We hook them up with our social service partners where we go, hey, John, we've seen you've been in the ER to manage your diabetes. What's going on with that? Well, when we dig a little bit deeper, we find that maybe John isn't picking up his insulin prescription because he's more concerned about putting food on the table rather than paying for his prescriptions. So we work with John on either finding discount prescriptions, or whether it is income and finding a job. If it's food insecurity, we hook them up with a food bank. But all of that process is automated through multiple data points. And if we didn't have a way to track patients in a secure way, we wouldn't start to notice those trends. We also have a program that is a large-scale grant called Comprehensive Primary Care, where we have individuals work with primary care practices and physicians to make sure they're getting the most bang for their buck. And these providers get dinged if they do not have good outcomes. So your Medicare, Medicaid bonus can result in, hey, you kept this many patients well this year, great job. You got this many well, you know what, you've got some kinks to work out. But I would say with COVID, everything has changed. A lot of our hospitals, because we're kind of a central data repository area, we've been able to share things a little bit better amongst systems. So whether that is, hey, I'm short gloves, and hey, I need gloves, and oh, well, I have extra gloves, we can connect those dots. But right now, I would say Surge is the most effective thing that's going on right now. So we track, Surge has different levels. So that just means, hey, we are operating at an emergency level. So take, for example, Surge level 1 basically means, hey, we've hit this amount of occupancy within our regional hospitals. We might need to be utilizing some secondary care areas. Surge level 2 is bringing in more staff, taking staff off leave, or anything like that. Another thing could be Surge level 3, where basically we go, hey, we're opening up the Duke Energy Center and we're going to have 150 bed capacity. So that tells us, that's a real-time data point that we constantly see to see, hey, do we need to start, building out Duke again? We've got it down now and we have a plan if that ever arises. But yeah, data is the backbone of every decision we need to make in real time.
So if I were to zoom out and really think about a spectrum, so you've got people on one end of the spectrum that make decisions based on gut and history and whatever, and they're not really using data. Then you take the next step forward and you say, somehow you've convinced them that they need to use data to make better decisions. So now you've got to get the infrastructure set up, right? How do we capture all this in a meaningful way? And then maybe step 3 is pulling some meaning out of that. Right now, it sounds like if you're at step 3 or level 3, you're reacting, right? So you're getting alerts, I'm aware, I see things automatically, cool. And then it feels like where we're headed is proactive, where you've got the AI and the machine learning running in the background to help identify potential issues before they are issues. So it feels like that's kind of the spectrum. And I think it's difficult, but we're moving quickly towards step 4, which is being proactive and having the data tell us before there's a problem. One example we have, so we're using communication. So how does a company communicate? Great, and how are employees consuming that communication? So One example of that would be, if you think about back to Netflix, they know every subscriber and the likelihood that they will not renew their subscription based on behavior. So they can see, oh, Krista stopped watching, binge watching or whatever. They know where you're located, your age, what you've watched in the past. And then that's where they throw it into a machine learning model. And they'll say, based on machine learning, what are the odds that Krista does not renew her subscription in the next 3 months? She's at 82%. I mean, they get it down to very specific. Now they can be proactive around those specific subscribers. And how are we going to retain her? Right? So this is a whole different level of thinking. It's all based on data. We do something very similar in terms of, could we tell a company who's most likely to quit just based on their behavior? Not based on surveys, because people lie, exit interviews, because people lie, pulse surveys, because people lie, right? So if you are basing your input into your model based on what people are telling you, you're starting with bad inputs, you're going to have bad outputs. And that is why you don't get surveys from Netflix and Amazon and others, because they want real data that they can count on. And so sounds like that's the spectrum. And I know we've got some folks in the audience from Big Co's, and we had talked about, well, how do you convince leadership, right, that data is important? So I'm going to throw this question back to the two of you. So Nicolette, let's start with you. You said you've been at the city of Cincinnati for 5 years, or the department's 5 years old. Is that right?
Yeah.
What led to the initiation of this department?
Sure. So that's a fun story. Our office was actually one of the first actions by the new city manager that was hired under Mayor Cranley. So he brought in city manager Harry Black, who had gained his chops in Baltimore, which, as I shared with you guys yesterday, for any Wire fans on here, everything about CityStat is true. It's real, of putting data up behind and making leadership stand up and talk to it. So his vision was to bring that to the city of Cincinnati, and he was the one that had the idea around layering in innovation. So not just holding people accountable, but how do we help you reach that accountability, instead of having the departments go up and say, we're doing a bad job, and you say, go do better. That with how our office is structured, we say, you're doing a bad job and we're going to help you. And then we're going to celebrate with you now that you're doing a good job. So it was really his vision to bring that here. It's gone through a lot of growth since then. We have moved far beyond bringing people in and making them stand up and answer. I think that probably was still a very important phase of how we gained buy-in. I really can't even dream of how cities are doing this if the buy-in didn't start at the top, because we were very fortunate that it was the tippy top of the organization. The CEO came in and said, like, data is what we're doing. And then it was more, how do we get that ingrained into the senior leadership, and that we weren't trying to grow from the top up. I think it's also very important that he made the call that data sits at the executive level. It's not some side project of IT. It's not like a user group that some people who kind of understand how to use a computer do for fun. Like, this is a tool of the CEO to do his job, to hold you accountable and to get outcomes for the city. So we definitely had a leg up in engaging that. But I think the more tactical way, if you don't have that, is that you have to be able to perform with results. So you can show data all you want, but if you can bring the data, give them an actionable insight, and then be able to show with the data that actionable insight had the outcome that you said it was going to have, that's where you can really start to gain buy-in. People love hearing these stories that Netflix knows how to get me. Like, also, if you want to ever test how to know who's trying to leave your company, like, please let me know. That sounds amazing. Like, everyone wants to know how to do their job better. And hopefully more automated, but a lot of people are mostly just scared about that. It sounds difficult or hard, or like they're watching The Matrix and it's futuristic and way out there. So if you can bring it to them consumably and then show them that it has a benefit to them, I haven't had hardly any trouble from there. I can't speak to a lot of other organizations, but getting people to buy into data, even in the bureaucratic, slow little government over here, has actually not been as difficult as you might think it would be.
So that's got to be super positive, right? If you work for a big co, and if the city of Cincinnati can do it, you should be able to do it, right? You're for profit. You're supposed to go fast, right? You want to be efficient and make money. Krista, can you talk a little bit about why is data important at the Health Collaborative? Who was behind that? Was it always that way? Can you give a little background?
Yes, so the Health Collaborative was originally 3 organizations that became one. So like the Greater Cincinnati Health Council that's been around since I believe the 50s. What's really cool is actually in our CEO's office, I should have grabbed it since I'm here. It's a little book that was used in like the 60s and 70s, and a lady drove around to every hospital and recorded live births on every line. And they were like, baby boy, born, morning, Christ Hospital. And I was like, wow, that is how they would literally turn this into the health department, and the vital statistics would go, okay, yep, there's a baby. And just now we have the ability to track infant mortality rates and what that truly means in a community. So it's completely changed everything. And for the buy-in for leadership, I would say it always boils down to that ROI. And what's really difficult in healthcare, and if there's any EPIs or engineers out there, it was very, oh, Eric, I like that, baby boy. I love that comment. What's really cool to see is the progression. However, it's so hard to say this didn't happen because of this intervention. And those are the data points that we want to capture. How many kids were able to graduate high school because they didn't do drugs? How many people started changing their diet and they didn't have a cardiac event?
Right.
So that's what makes, I believe the last time it was calculated by the Robert Wood Johnson Foundation, for every dollar you spend into public health, you get about over $5 back because of the things that didn't happen in your community. Things like condoms, things like seatbelts, things like wearing a mask. Those may seem like tiny tasks. However, they prevent harm. And the harm reduction movement, whether it is, I could personally attest to actually using both of your software to help me. So I used to actually work for the city of Cincinnati, and one of my favorite dashboards is the overdose tracker. So they track all the overdoses that occur, and I believe is the data still from 911 and EMS dispatch. So so that for the health department, we knew where the overdoses were occurring, because then we found out statistically people use within 4 blocks of buying whatever their drug of choice was. So we knew where to keep certain officers, where to provide help, where more information is needed from organizations like Talbert House or Brightview or things like that. So it just totally allows us to kind of intervene at the right time and the right information.
Right, so that's a great example of, we don't have to guess where to put people. We have data that says we can be really efficient because we know these are hot spots. Mm-hmm. And so it shouldn't be, this is the way we've always done it, which drives me crazy as a technologist. But I don't care. It's wrong. And I have the data to prove it. So I get worked up about that. All right. So let's change gears briefly. So I know we have some potentially college students in the audience. So Krista, I'll ask you, what would you go back and tell your 21-year-old self now that you've got this career in data and understanding data? What do you wish you would have taken or understood or majored in, minored in? Talk to the 21-year-old you.
I would say I'm kind of a unicorn with my education because I was the only person that got into my MPH program that didn't have MD or RN after my name. So I was already a weird odd man out, and I would ask these questions of like, well, I don't really know much about virology, but I can tell you about behaviors in sociology. I think I would take more tactical communications courses because honestly, the most valuable things in public health have been around sociology and health behavior. And that has made me, one, a better communicator, and then two, you really start to see, no one's going to change behavior unless they change it themselves. No amount of guilt, no amount of saying you need to wear a mask will make people wear a mask. So we need to find that intrinsic motivation of what really happens. So those psychology courses that you may kind of like, it's a 101, maybe take it.
Yeah, that's great. Nicolette, what would you say to the 21-year-old you?
Yeah, I mean, I think I'll build off of Krista's again, and like I would tell 21-year-old me, like, good job at getting a liberal education and not just going for like the easy thing that slots straight into a career. So I originally started out in engineering, and engineering, just like I know I don't look super old, and I'm not, and data analysis wasn't something that I could major in. I would say in most universities that started really 5 years ago, and most of it's still housed in their business school, which I have some strong feelings about. If any business majors want to talk to me about analytics only through business intelligence. But I think it's really important to get that understanding. And anyone can be taught how to use a tool. Anyone can be taught how to use the computer, how to use Excel, how to do some of these basic things. But it's really that contextualization. And as Krista was saying, the communication thereafter. If you can't understand your audience, it doesn't matter if you technically know how to build it. If you can pull out these data points and see these trends, and you can't communicate those in a compelling way to senior leadership to make action on, then it doesn't matter. So I think it really is making sure that you're getting a well-rounded experience. If you think that your like Common Core classes aren't useful, I know many people, you have at least two of us on here, that those are the important things that we use in our life. I can go on YouTube and teach myself the new release of Tableau, but I can't go on YouTube and easily learn how to be a better communicator. That's really such an immersive experience that leveraging it for different experiences and things that stretch you within school.
Yeah, I think that's great advice. I think if I were talking to the 21-year-old me, so the first thing I would say is invent Facebook. That's the first thing I would tell myself at 21 is go back and invent Facebook. The next thing I would say
in Bitcoin.
Is Bitcoin, yes.
Yeah,
all these
invest in
things
Bitcoin.
I think I'm very logical, right? I think most engineers are super logical. One of the things I've learned, and I love numbers and I love math and I love statistics. I think I would have spent more time with even statistics, but 2 points that I think tie into what you both just said. One is using your college experience to really, there's 10,000 plates of food on the buffet. And we get so fast tracked, especially now, because my kids are kind of going through this. They get so fast tracked to kind of get in, know what you're going to be, and get out, as opposed to use that experience to really get a broad understanding of the world, different cultures, different languages, how people think, how people feel, how to communicate effectively. I feel like that a lot of that's missed. So I think I would have done more of that, going back and talking to myself then. And the other thing that I found that is unbelievably important, and it's one of the characteristics I look for in every single person we hire, regardless of role. Do you have empathy? Right? If you can't feel what the other person is feeling, so think about software design. If you don't know what that would feel like to use this piece of software you've created for 8 hours, you can't feel that, you're going to create crappy software because you're going to use it for 5 minutes and say it functions. but you're not really thinking, what if I had to do this for 8 hours a day? How would this make me feel? It's a different level of perception. If you're in marketing, how would this messaging make me feel? All of it, I think to be effective requires empathy. And I feel like a lot of people miss this. It's just one of those traits I've seen, like all the best people I've ever worked with have a crazy level of empathy. It just allows them to see the world in a different way. And I think it ties back to points that we were making earlier, which is how do you talk to leadership, right? You have to understand what's driving them. ROI, Krista, you brought up ROI. That's a huge point, right? At the end of the day, bottom line, we need to be more efficient. We need to be saving money. We need to be better. And if data can help us get there, they're going to do it. So I think that's great advice. Hopefully we've got some people in our audience that are maybe looking for majors or minors or other things that they can do to help them get prepared. Well, I think the advice from this group would be, don't be so narrowly focused on one thing, right? Don't just be a math major. That's not going to help you. You'll be the person that can see the data, but you can't communicate it. You can't explain why it's important. Okay, so I think we're at time-ish. Maurice has got a great t-shirt idea. So real quick, let's go back and see if we have any questions we want to get to. So Nicolette, you talked about visualizations and you're using Tableau for all of that. And you posted links that people can see those visualizations online. Let's see if there's anything else. All right, so with that, people want to reach you, where can they find you? Krista, where can people find you? Online?
Yeah.
You want to give out your personal cell phone number? I think that's where we're headed.
Nah, the reporters already have it. Yeah, I can post. My Twitter is just my name, Krista Hyson, and you can always submit questions.
And are you on the LinkedIn?
I am on the LinkedIn. Yes.
All right. And Nicolette, what about you? Where can people find you? And if you want to post that so they can reach you?
Yeah, so I'm going to give you guys my email. As you've already seen, my name is fairly complicated and spelling Cincinnati is complicated too. So I recommend a good copy and paste on that one. I would also encourage, I technically have a personal Twitter. You're probably not going to successfully reach me, but our office manages a Twitter that you can follow, especially if you guys are interested in COVID-related information. We are responsible for the city of Cincinnati's communication on updates on cases, hospitalizations, things like that. In what our office likes to call the yesteryears, we posted other information about city data and hope to be doing that again soon. But if you reach out on there, you'll either get me or someone on my staff. I'd also love if there are students on here that are thinking about wanting to do data. I will share that my office only has one person who is classically trained in data analytics. We all come from very different backgrounds, so also happy to connect any students with myself or anyone else on staff to talk more in depth about our experiences. And I think I wouldn't be too bold in saying that our person that majored in data wished that she had taken the advice that we were just talking about and getting a more well-rounded understanding of other aspects of the world to apply to data.
Awesome. I'll post, so that's my LinkedIn and that's me on Twitter. So if anybody has any questions about whether, and I think we really had three audiences. So if you're a startup, I'm a startup guy. If you're thinking about pivoting or wanting to get into machine learning, AI, happy to talk through that, different business ideas, or maybe make connections for you. We've got students as an audience, so hopefully we've provided some guidance there in terms of maybe things, additional things that you could be thinking about, but feel free to reach out if you've got questions. And then hopefully we've got some big co's, and if you want examples, if you've never heard of Tableau, you've never used Tableau, if you want to talk about how we're using machine learning and AI at our business, we're happy to share all of that. I just feel like this is the future. And if you don't believe that this is the future, all you have to do is look at Amazon. And so this is going to be kind of me on my soapbox at the very, very end to wrap it up. So Jeff Bezos, he's not selling books. That's not what he's doing. He doesn't care about product. He is gathering data on you, and he's getting a 360-degree view of who you are. Why do you think they bought Whole Foods? Because now they can see your food and your diet changing. Guess what? Now I know exactly what products to offer you. And they're going to keep expanding to learn more about you, because the key isn't e-commerce. The key is data and knowing who you are. That is the future. So hopefully you got a lot out of this session. Thanks to Krista and Nicolette for making time. And hopefully if you have any questions that you'll reach out to us. So thanks for attending.